So what is networking? So it is the process whereby professional links are established through which people can share ideas, knowledge, and information. Okay. So we also have here mentor. Okay. A wiser or more experienced person who guides, supports, and nurtures less experienced nurse or less experienced person. Okay. We also have here preceptor. So used to describe an experienced nurse who assists the new nurse in improving clinical nursing skills and judgment. Okay, those nurses who are experienced, okay, in terms of the work or the task of a nursing personnel should teach the new nurse about improving those nursing skills and how to make good judgment in terms of nursing care. We also have here effectiveness. Okay, it is a measure of the quality or quantity of services provided. So how effective the nursing interventions made by the nurse. Okay, that's the effectiveness. So when we say efficiency, okay, it is a measure of the resources used in the provision of nursing services. So when we say efficiency, it is when the nurse uses the resources well, okay, in providing nursing care to his or her patient. We also have productivity, okay? It is a performance measure of both the effectiveness and efficiency of nursing care, okay? Measured by the amount of nursing resources used per client or in terms of required versus the actual hours of care provided. So that is your productivity, okay? So now let's proceed to nurse as delegator, okay? So what is delegation? Okay. It is the act of transferring to a competent individual the authority to perform selected nursing tasks in a selected situation. Okay. So that means in your delegation, it is not just about delegating the task to a person. Okay. You should consider that the one you are delegating the task should be a competent individual who you know that he or she would accomplish that delegated task well. We also have your delegate. Okay, he or she assumes responsibility for the actual performance of the task or procedure. Okay, your delegate is the one where you delegate the task, especially the nursing intervention or the nursing task. Okay. When we say delegator, it retains accountability for the outcome. Okay. Delegator is the one who delegates the nursing actions to a delegate. Okay. We also have change. Okay. It is the process of making something different from what it was. Can involve gaining new knowledge or adapting what is currently known in the light of new information. So it is an integral aspect of nursing. Okay. So that is your change. So change agents. Okay. These are individuals who initiate, motivate, and implement change. Okay. So they are considered as change agents. We also have types of change. We have planned change and unplanned change. For your planned change, an intended purposeful attempt by an individual, group, organization or larger social system to influence its own current status. Okay. So we have here covert change and overt change. When we say covert change, it is hidden or without awareness. Okay. So the change is hidden and nobody is aware, okay, of that. When we say overt change, it is an obvious or open change where person is aware of that change. When we say unplanned change, it is an alteration imposed by external events or individuals. So occurs when unexpected events force a reaction. Okay? So no one plans regarding that change. Okay? It happens naturally. Okay? It happens unexpectedly. So we have two types. We have the drift change. It occurs without effort on anyone's part. Okay? Also, we have your situational or natural change. It occurs without any control by the person or group impacted. The nurse's role in change. So we have Lewin. Okay? He proposes the unfreezing, moving, and refreezing stage. Okay? So in order to take effect, the change is we have to unfreeze the current situation or the current policy, for example, then implement the change. That's the moving part, and after that we have to refreeze again. Okay, to maintain that changed policy. Okay, in an organization. So that's your unfreezing, moving, and refreezing stage. We also have to establish likelihood change will be accepted. There are mean markers that show acceptance. Change takes time. Okay, test on small scale first. Okay, so in order to change something, for example, a policy or a procedure in an organization, you have to test it first in a small scale before applying it to a larger scale in the organization. Change accepted better if people are involved in the process. Okay, so we have here accessing optimal power. So we have to analyze organizational chart for formal and informal lines of authority. Identify key person who will be affected by change and those directly adjacent. Find out as much as possible about these key people. Also, we need to build coalition of support before you start the change process, and follow organizational chain of command, and do not bypass anyone. Okay? So we have here common driving and restraining forces for change. For your driving forces, this means that these are the factors that drive a particular person to change, to make changes. Okay. First, we have your perception that the change is challenging. Economic gain. Okay. Perception that the change will improve the situation. Visualization of the future impact of change. Potential for self-growth, recognition, achievement, and improved relationships. We also have your restraining forces. Okay, so these are the factors that inhibit or are considered as barriers for change. Okay, so we have here fear that something of personal value will be lost. For example, threat to job security or self-esteem. Misunderstanding of the change and its implications. Low tolerance of change related to intellectual or emotional insecurity. Perception that the change will not achieve goals. Failure to see the big picture. Lack of time or energy. Perceived loss of freedom to engage in particular behaviors. Okay? So these are your common driving and restraining forces for change. Okay. So here, I have a statement regarding the change topic. So, change that is viewed as a threat by one nurse may be viewed as an opportunity by another nurse. Okay. So, change is a subjective decision of an individual or a person of a person. Okay. So, change can be viewed by someone as a positive gesture. However, others would consider it as a threat or a negative gesture. So that's it. So I think this is the last slides of our discussion regarding nursing leadership. So